Welcome to Clyde Ellis Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options. My guest today is Dr. Dennis Quo, the Division Chief of General Pediatrics at UBMD and the attending pediatrician for Kaleida Health. Today, we'll be discussing a common virus known as RSV. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Quo. Thanks for joining us today.
Thanks for having me.
It's the dog days of winter. We're kind of getting through the tail end of it. We're here to talk about RSV.
Yes.
So if you can tell us a little bit about what RSV is.
Respiratory syncytial virus is what RSV stands for. It causes colds in you and me. It causes colds in most kids. In young babies, it has a tendency to do more than just cause a cold. It'll actually go down into the airways, and it can cause something called bronchiolitis. So you think of it as a cold that just travels down to your airways.
Sure. So it seems pretty common, and that's what when people say, "Boy, it's going around." That's what it is right now.
It's very common. It's a very, very common cause of colds during the winter. It's thought that maybe 5% of adults will get RSV causing a cold during the winter. About all kids will get RSV at some point before they're 2 years of age. So it pretty much runs rampant through the winter time.
Right. So is this something that will go through classrooms, go through youth sports teams, go through church groups, things like that?
It can. There are so many other viruses that cause colds during the winter that it's hard to say for the older kids and adults whether it's RSV or whether it's something else.
Sure.
But we definitely see it quite a bit during the winter in the young kids.
Okay. How can, if you're a parent and you're watching this, how can you tell the difference between RSV and the common cold?
Most of the time you really can't. But we do ask parents to watch how the child is breathing. RSV, if it causes a cold, isn't really any different than any other cold. And it's really the young infants that we start raising concerns about. So we ask parents to look at how their kids are breathing, and we look at how they're feeding, particularly if they're keeping up with drinking.
Sure.
If a child is having trouble breathing, then they tend not to drink as much, and that's when you start raising flags.
And when you're saying trouble breathing, is it wheezing? Is it, they're stuffy, they're congested?
So they get junk in their airways, and that causes wheezing. And what parents can notice is that they might be breathing faster than normal. They might be a little more labored, so they're struggling to breathe some more. And faced between a choice of breathing or drinking, the child would rather breathe, which is why the drinking starts to go down.
Okay. And so, if before the parents take that next step and move them on to the primary care doc or even the emergency room, are they supposed to hydrate the kids? And what are some things that the parents should be doing?
So parents should always try to encourage fluids. And we say this with any cold or any illness. With young kids, they definitely want to encourage drinking as much as possible. And sometimes kids will respond to being offered fluids more frequently. They may get a little bit more out of breath quickly, and they may not take as much at a given time.
Specifically, what types of fluids? Are we just talking water? Are we talking 7-Up, Sprite, Pedialyte, Gatorade? What kind of fluids?
So for young children, a fluid that contains electrolytes is always preferred. Sometimes we call them oral rehydration solutions. Pedialyte is a name that we frequently recommend. You want to have something with some sugar and some salt in it, because if you drink just nothing but water, has no nutrition, has no salts, the child can get sicker.
Sure.
For older kids, I'll frequently say just anything you can get in them. Frequently, a child may be eating a little bit, and therefore it's important to just get any fluids whatsoever you can get into them.
Okay. Is there any type of specific medication for RSV in terms of whether it's at home, before a primary care doc or the ER would intervene?
There's no medication that will make RSV get better any more quickly than just leaving it alone. If a child has a fever, we frequently will advise Tylenol or ibuprofen. And the reason is because a child that has a fever may get dehydrated more quickly. They may breathe a little faster, which may also cause them to get dehydrated a little more quickly.
Sure.
And it makes the child more comfortable, so they tend to drink more if their fever is down.
At what point does a trip to your pediatrician, your primary care doc, or even the emergency room become necessary?
So I always ask parents to watch for how well the child is drinking and whether they get dehydrated. That tends to be a pretty good indicator of whether they're having trouble breathing, because if a child is forced to choose between breathing and drinking, they'll choose breathing. We ask parents to watch the number of wet diapers. If they're trending down to about 3 or 4 wet diapers in a 24-hour period, they definitely need to call the doctor or go to the emergency room, because that's an indication they're not drinking enough.
Right, right. Is this winter particularly harder with RSV? Are there different years where that, seems to be much worse?
It's hard to say because RSV tends to be pretty bad every year. We see a lot of kids in the hospital that are infected with RSV every year. So we see seasonality with RSV. It tends to be more during the winter months rather than the summer. But it's hard to say whether it's worse one year than another. It tends to be pretty significant every year.
Sure. So it's a significant issue that you guys are constantly dealing with. As we wrap up, are there things that parents can do to make sure that they're taking precautions? Are there things that the kids can do? Is it hand washing? Is it, avoiding contact in certain things?
So with RSV, hand washing and contact is the most important way to try to prevent your child from getting RSV. Pretty much every child will get RSV at some point before they're 2 years of age. With a very young child, particularly if a child has an underlying medical condition, child with prematurity, child with heart condition, child with a lung condition, it's particularly important to be vigilant around those kids. For older kids, RSV tends to be more of a nuisance than anything else, and we always advocate hand washing and just good hand hygiene for those kids.
Sure. Sure. Well, Dr. Kuo, I know these are busy times for you between RSV, the cough, the cold, and all that. So thanks for joining us today.
My pleasure. Thank you for having me.
Thank you. I'm Mike Hughes. Thanks for joining us on Medically Speaking. We'll see you next time.